Naomi Frist, a very well-known hygienist and who has been treating patients for a number of years, was introduced to the PeriActive product a few years back and has been recommending it since to her patients. So Naomi, first give us a little background maybe as to yourself, and then we could just discuss the product.
Sure. My name's Naomi. I'm a registered dental hygienist since 2012. I've been actively treating patients since, periodontal patients mainly, and loving it.
Naomi, perhaps you were introduced to PeriActive a few years back.
Correct.
And perhaps describe your initial reaction to the product and what you saw with your patients that convinced you that it should be used more frequently.
Okay, so I heard about PeriActive initially, and I didn't know enough about it. So I actually decided to look into it, and I saw the extensive research that there was to back it, including my patients who would rave about it, who heard about it, whatever it was. And I started recommending it since, and I've not been disappointed.
You know, there are a lot of oral rinses that are being marketed for periodontal care or for dental care or for overall oral health. What would you say clinically set PeriActive apart from those other rinses?
Good question. I think what sets PeriActive apart from the rest of the rinses on the market is that it targets the core of the problem, really tackles the inflammation, and doesn't stain the teeth, which is a nice benefit.
How do you find patients respond to the taste and the compliance uses associated with
My
it?
patients absolutely love it. I haven't heard a single complaint about the product, and everyone notices the difference and everyone feels the calmness in their gums. And truly, I haven't heard anything about the taste or anything negative in that sense.
Do you have any patients who complain about staining or any other issues with the product? Because that happens to be a common problem with a lot of the.
It is a common problem, specifically
rinses.
with very concentrated like Corsadil, chlorhexidine, whatever it may be. When it's concentrated, it does tend to stain the teeth. This one does not, which is a huge benefit.
So what type of patients in general would you say PeriActive would be most useful for, and which kind of patients do you recommend it for?
So I recommend PeriActive to anyone with anything including gum disease, gingivitis, periodontitis, as well as gingival recession, and just bleeding gums, anything that's connected to the soft tissue of the mouth.
And you've used other rinses in the past. Can you sort of document what you see the difference in how PeriActive addresses those problems?
I think it just targets the inflammation in a very effective way. I've actually noticed that when we have a period of time where my patient's traveling or whatever it may be, and they're not using it for an extensive period of time, I noticed that an extended period of time, I noticed that there's a regression in their gingiva and in the soft tissue of the mouth. And that's when I realized how effective it actually is. And more than me noticing it, my patients notice it, which is incredible.
Fantastic. So perhaps share with us a single specific instance where you saw PeriActive make a marked change in someone's health.
Oh, I actually had a case with an elder gentleman who suffered from a rare case of oral psoriasis. He suffered from flare-ups very often. And he came in and said he tried everything, every rinse, every remedy that he can think of. And he tried a whole bunch and he said nothing helped. I started him on PeriActive just, to see what would happen. And he came back 3 months later for his regular cleaning. And he was so thankful. He said he hadn't had a flare-up since, which is so rare for him. And that everything was staying nice and calm, which is huge for him. I hope he's still that way, but so far he's so good.
So if you treat a lot of periodontal patients and a lot of general dental patients, what percentage of the patients do you think you're using PeriActive in now as opposed to rinses before?
Almost everyone, really almost everyone, because there are no negative, it's only beneficial in every way. So there's no reason not to use it.
I had a well-known professor at one of the universities say to me, I'm an excellent dentist and I do excellent work. And PeriActive is one of the few products that made my excellent work even better.
Nice.
Yeah, it was very nice. And I'm now, as a hygienist, what would you say, how does PeriActive improve the excellent quality of your work?
I think that what we do only goes as far as it can go, and the at-home care of the patient is very important factor to it staying stable and staying, healthy throughout until their next 3-month visit or whatever it is. So adding the PeriActive to any periodontal patient, as well as any general dentistry patient, anyone that can be treated, really, really helps keep everything calm enough for when they get back to us. And everything is just nice and quiet the way we like it.
So it sounds like you're actually a big fan of the product.
Yes, very much so.
Sounds great. Well, Naomi, thank you for sharing time with us tonight.
Thank you for having me.
I appreciate your time, and I appreciate your experiences and your professionalism.
Thank you. And I'd have to say I'm a registered dental hygienist and I'm a very big PeriActive fan. Thank you for having me.
Thank you. Bye-bye.
Take care.